Hi, my name is Dr. Barry Caniglio, and I have a tip of the day for you in regards to carpal tunnel syndrome. Now, carpal tunnel syndrome is a menace to people, especially people who use their hands all day. It creates some pain, some numbness, some tingling, pins and needles, and the first three fingers typically can definitely be bothersome. First thing you need to do, especially when you sleep, is keep your hands in a neutral position. When you're sleeping, you tend to curl your hands up, and when you curl them up, it puts a lot of pressure on that nerve that runs through there called the median nerve. Don't extend them, don't curl them, keep them in neutral position, and there are braces out there to sleep with that are very comfortable to keep you in neutral position. Number two, what you can do, you want to use a very high grade whole food vitamin B6. Now this is one here called Cataplex B. Cataplex B is whole food, pharmaceutical grade, and it helps heal the nerves a lot faster. Now, we are very successful in the treatment of carpal tunnel syndrome because we try to affect and relax the nerve in 3 different locations. And it's not just here in the wrist. We will affect that, but it's also here in the forearm and as well in the neck, because the nerve actually exits here and comes down the arm and through this little tunnel here in the wrist and out to these first 3 fingers. Alright? So let me show you what we would do to try to help the nerve here, here, and here, and you'll definitely have your best outcome. First thing, we would use low-level treatment of a laser. Now this laser is painless and it releases the oxygen in the cells to expedite or enhance the healing. We would do a treatment on this for probably 60 to 90 seconds, number one. Number two, there are some release techniques that we do to try to release these muscles and ligaments in here to try to take the pressure off the nerve. This is one of the techniques that we do, and it's to work on these thumb muscles to try to relax the thumb muscles and the wrist muscles. These are release techniques. Now, there is an ArthroStim device right here, and this is this instrument here to try to stimulate one of the bones in the wrist to try to push that back into position, again to take the pressure off that nerve that goes down there through the neck, through the wrist. This is a percussor, and this percussor is great at relaxing muscle spasm and increasing oxygen to the area that we're working on. Now we're working on a muscle here called the pronator teres muscle. Now this muscle, when it gets tight, especially if you use your hands all day, those muscles in here get really tight, and in spasm puts pressure on that nerve that runs down through there. On your back. On your back if you could. Last thing and the most important thing is to evaluate the vertebrae and the nerves in the neck to try to reposition those vertebrae off the nerve. That right there will take the pressure off the nerves in the neck. Any questions whatsoever, please do not hesitate to contact our office. Have a great day.